patient navigator director, I coordinate a team of 4 registered nurses, 2 social workers, 2 registered dietitians, and a massage therapist. My group huddles every morning. During the pandemic, that has been very challenging because we had to go to bigger and bigger spaces because we could not be in a small space. There used to be a lot of meetings. There's not that many meetings anymore. Those have changed, of course, to a lot of Zoom meetings or webinars. We get a lot of calls from the clinics and surgeons' offices needing urgent needs for patients. Sometimes, especially those patients who have extreme emotional needs, they need a social worker or a nurse navigator right there right away. And we do support when patients are not doing well to get them to the emergency room if they need to. Most of our patients that need help are 250% below the poverty line. So we do make sure that the people really truly need these resources. But that's why we're able to do what we do, because we have very generous philanthropic donations, and we're very grateful for that. We did have a patient who came in. They had been in treatment for a while with several different types of cancer, but had came in for a scan that day and found 16 more areas on his brain. They're from out of town, so it's a little bit of a drive, about a 2-hour drive. They were just stunned, and then they were told that they were going to have to start a gamma knife treatment that was going to be several hours long at 5 o'clock the next morning. So one of our social workers met with them, talked to them, and then asked me, can we just provide them lodging for tonight? Because these are not particularly young people, and for them to have to drive another 2 hours to get up in the morning at 2 o'clock in the morning to get back here wasn't going to happen. So they were very, very grateful that we provided them some lodging for that night, so they did not have to make that long drive. And honestly, the wife of the patient was more than too anxious to do that type of driving. So I was real proud that we were able to help them. My position changed very much, particularly at the very beginning of the pandemic, because I was involved in the screening at our front door. We do a daily screening of every person who comes into Mary Bird Perkins Our Lady of the Lake Cancer Center. I still met with my team daily, and we still had our huddles, but I spent a lot of time at the front door helping with screening and doing reassessments. The physicians can say a family member needs to come in certain instances, and it's up to that practitioner to make that decision. But if the family member wants to be involved but they cannot go upstairs, we actually put a second armband on them with a phone number and the name of the loved one, and the physician will call them when they're having the discussion with the patient. We certainly have seen an impact in not allowing family to be here. It is a loss. I know I've heard several of the physicians and nurses in the clinic say they'll have to call the family and kind of go over the same thing again. So it's really related to the patient hearing the messages from the physicians and the nurse practitioners. Chemo teaching is much better done if you have somebody there with you who's going to be living that life with you. All of us who work in medicine, particularly in oncology cancer, are very concerned that there's going to be a lot of patients who have not sought treatment or are going to come to us in later stages of cancer and be sicker and need more care. So their emotional needs, their financial needs will probably be a little higher than if they would have come here with a stage 1 cancer versus a stage 4 cancer. So we've discussed this in our tumor boards and we've discussed it in meetings, but we are concerned about that. I truly implore all people to continue taking care of their health, because we don't see this going away in the foreseeable future. So it's a good thing to come, and we are here to help you. I will say it's been kind of interesting, especially in the spring. It was kind of like a fashion show at the front door, because this was the only place people went. So that they would come all dressed up to see their doctor or to get their treatment. But no, my message is please continue coming for your treatment. And if you feel you have something going on, seek medical health. We have gotten several gift cards from different area vendors that they brought for the employees here. So that's been fun. And we've had some food donations. But so the community has supported us, and our senior management team has supported us also. I have been told, and not just me, it's anybody who's in that screening area, thank you for being here. God bless you. We wouldn't be able to do this without you. to see the looks of family members in their eyes when they have to leave their loved one here, because we don't allow a lot of visitors into the cancer center now, and seeing their appreciation and knowing that their loved one's going to be taken care of because we're here for them. So that's what motivates me.
Yeah.
And my team. My team works real hard, and I want to be here to support them.